TVC News, Abuja.
Away from the National Assembly now, across the African continent, health systems are under growing pressure from multiple threats like climate change and disease outbreaks to chronic illnesses. Experts at the 2025 Gatefield Health Summit say the time to act is now by building resilience and securing the continent's health. We have details in this report.
From deadly outbreaks like Ebola and COVID-19 to the silent epidemic of non-communicable diseases such as hypertension and diabetes, Africa's health systems are struggling to cope. Experts say resilient health systems, from the backbone of healthy societies, are capable of absorbing, adapting and recovering from health emergencies while maintaining essential care. But data reveals the gaps are still wide, with over 10 million people pushed into poverty every year by healthcare costs.
Our health systems need resilience. We need to fix the primary healthcare system, not just in Nigeria, but in Africa alone. We need to build pandemic preparedness because Lassa fever is on the rise. We also need to ensure that our medicines need resilience. We have a lot of people that are suffering from antimicrobial resistance.
A lot of different lifestyle factors now are making everybody will be wondering, why are the statistics going up? Why is it increasing? You hardly talk to someone and they don't know someone that has cancer, unlike before. That is something that is a little alien.
Stakeholders here at this summit are now seeking stronger collaboration among African nations to build sustainable systems that protect every citizen by investing in health workforce, infrastructure, scaling up innovation for service delivery, and strengthening community preparedness.
Average spend per year on a Nigerian is $5 per year. That's for each of us here, the government spending $5 each. When you take that to Europe, it is about $4,500 per person. When you move that to Switzerland, it's about $12,000 per person that has been spent on healthcare. And even Kenya, that is like, another African country that's comparative is 66. That means even Kenya spends 10 times more than the Nigerian government spends on healthcare per person, even though it's very low.
One of the things we'll be doing today is thinking about how do we reshape food systems so that it works better for everyone and not just a few, and how do we also look at our environment and how it influences how people come down with non-communicable diseases.
With Africa's population projected to exceed 1.5 billion by 2030, experts warn that without immediate action, health shocks will continue to reverse development gains. Kemi Balogun, TVC News, Abuja.
A bit of politics. Members of the Northern Bridge Builders Forum have